today we are going to look into LO3. 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 Understanding the inequalities in health and social care determinants. Okay. Understanding the inequalities in health and social care determinants. Okay. So let's see. Establishing key terminology. What are the health determinants? Okay. Health determinants refers to the various factors that influence our individual health status and can contribute towards its onset, illness, or disease. These factors can be biological, environmental, social, or economic, and they can vary in their level of influence on the individual's health. Okay. Some common health determinants include genetics. A person's genetic makeup can play a role in their susceptibility to certain health conditions such as inherited disease or generic predispositions to certain diseases. Environmental factors such as air and water quality, housing conditions, and exposure to toxins or pollutants can all affect an individual's health status. Then we need to talk about lifestyle factors. Lifestyle factors such as diet, exercise, smoking, alcohol consumption, and drug use can have a significant impact on an individual's health. Social factors. Social determinants of health include factors to income, education, employment, social support, and access to healthcare, which can all impact an individual's health outcomes. Healthcare access and quality. Access to quality healthcare services and ability to receive timely and appropriate medical care can also influence an individual's health status. Very important. Okay. Very, 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 very important. Health and access and quality. Access to quality healthcare services and the ability to receive timely and appropriate medical care can also influence an individual's health status. So these are very key factors that we need to look into. Okay, so we have tables that outlines some of the key health determinants and associate factors. Age, chronological age, biological sex. Then we have to look at the lifestyle, diet, and nutrition habits, social and community networks, socioeconomic, income and wealth, cultural factors, environmental factors, and conditions. Okay. Nature and generic factors and heredity. Okay. Environmental and social influences on development and behavior. These are all things that we need to look into when it comes to some of the tables that outlines them. So age, what are the factors? Chronological age, psychological changes related to aging, then sex, biological sex, gender identity, hereditary factors, genetic makeup, family history of illness or diabetes. There could be, or diseases. There could be, you may have diabetes or asthma in your family line. Lifestyle, diet and nutrition habits, physical activity and exercise habits, substance use, abuse. Okay, those are things that you have to look into. Then socioeconomic, income and wealth, education level, occupation and employment status. That's that. Then you have cultural factors, beliefs and values related to health and wellness, cultural practices related to health and wellness. Okay. Then we have environmental factors and conditions. We have air and water quality, access to green spaces and recreation areas, exposure to toxins, pollutants, and environmental hazards. They have nature, genetic factors, and heredity, environmental and social influences on development and behavior. Okay. Let's look at health and well-being inequalities for different social groups. Social class. Okay. What are the health inequalities? Lower life expectancy, high rates of illness and diseases, and proper health outcomes. But we'll have to look into the contributing factors: lack of access to healthcare, lower quality of education, higher levels of poverty, exposure to environmental toxins. Okay, very important. So these are things that you have to look into. Then you can look into race and ethnicity. Okay, race and ethnicity. Higher rates of illness and disease, poorer health outcomes, lower life expectancy compared to white populations. Okay. And then gender. Men have higher rates of mortality, while women experiences more illness and disability. Okay. So there could be difference in biological factors, societal norms and expectations, and access to healthcare. Okay. Then we have geographical region, including rural and urban living. Rural populations experience higher rates of mortality and poor health outcomes compared to urban population. Limited access to healthcare, lower quality of education, and higher levels of poverty. Disability. Higher rates of illness and disease, poorer health outcomes, and lower life expectancy compared to non-disabled populations. Lack of access to healthcare, discrimination and stigma, and physical and social barriers. Healthcare services. Age. Older adults experience higher rates of illness and disability compared to younger population. Biological factors, changes in lifestyle habits, and access to healthcare. Vulnerable groups, AG, homeless, sex workers, vulnerable migrants. Higher rates of illness and disease, poorer health outcomes, and limited access to healthcare compared to the general population. That's true. Okay, what then are the contributing factors? Lack of access to healthcare, exposure to environmental toxins and hazards, and socioeconomic marginalizations. Okay, it is important to know that these factors are interrelated and that individuals may experience multiple forms of social disadvantage or marginalization that contribute to health and well-being inequalities. In order to address these inequalities, it is critical to understand the underlying factors and to develop policies and interventions that are tailored to the unique needs of different social groups. By addressing the root cause of health and well-being inequalities, it is possible to promote better health outcomes for individuals, regardless of their social background or circumstances. Okay. Okay. So this is what we need to know. It is important that we know this. Okay. Factors are interrelated. So in order to address those, it's critical to understand the underlying factors and develop policies and interventions that are tailored to the unique needs of different social groups. By addressing the root causes of health and well-being inequalities, it is possible to promote better health outcomes for individuals regardless of their background or circumstances. Social class. Social class is a complex concept that can have a significant impact on health and well-being. Individuals from lower social classes tend to have their life expectancies, higher rates of illness and disease, and poor health outcomes compared to those from higher social classes. There are several factors that contribute to health and well-being inequalities for individuals from lower social classes, including lack of access to healthcare, lower quality of education, higher levels of poverty, exposure to environmental tolerance, discrimination, and marginalization. Right? These are all several factors that contribute to health and well-being inequalities. Okay, so these are very important. So where lack of access to healthcare play a major role in terms of primary care, specialist care, preventive services, vaccinations. These are all things that we have some lack of access to. Lower quality of education. Individuals from lower social classes may have lower levels of education, which can limit their employment opportunities and income potential. This can contribute to higher levels of poverty. Then we look at higher levels of poverty. Individuals from lower social classes are more likely to live in poverty, which can contribute to poor health outcome due to limited access to nutritious food, safe housing, and healthcare services. Exposure to environmental toxins. Individuals from lower social classes may be more likely to live in areas with higher levels of environmental pollution, which can contribute to higher rates of illness and disease. Discrimination and marginalization. Individuals from lower social classes may experience discrimination and marginalization due to their social and economic status, which can result in limited access to healthcare services and other resources. Then we have to look into the race, ethnicity, gender, geographical region, including rural and urban living. Race, ethnicity. Race and ethnicity, individuals from minorities, racial and ethnic groups may experience higher rates of illness and disease, poorer health outcomes, and lower life expectancies compared to white population. Factors contributing to these disparities may include discrimination and racist, lower quality of healthcare, and lack of access to healthcare service. Okay, you have to look into gender. Men and women may experience different health outcomes due to difference in biological factors, societal norms, and expectations and access to healthcare. So, for example, men have higher rates of mortality, while women have that to disability. Okay. So, therefore, addressing health and well-being inequalities related to gender requires efforts to promote gender equality as well as efforts to address difference in biological and social factors that may contribute to different health outcomes. Okay. They have the geographical region. Geographical region, including rural and urban living, individuals living in rural areas may experience higher rates of mortality and poorer health outcomes compared to those living in urban areas. Factors contributing to these disparities may include limited access to health, lower quality of education, and higher levels of poverty. Addressing health and well-being inequalities related to geographical region requires efforts to promote equal access to healthcare services and other resources for individuals living in rural areas, as well as efforts to address underlying issues related to poverty and educational attainment. Okay. Disability, age, vulnerable groups in society, and inclusion health all represent important areas of health and well-being, including that require attention. And so let's then look at disability. Disability. Who are termed disabled or those with disability. So we have Individuals with disabilities may experience higher rates of illness and disease, poorer health outcomes, and lower life expectancies compared to non-disabled populations. Factors contributing to these disparities may include lack of access to healthcare services, discrimination and stigma, and physical and social barriers to healthcare services. Addressing health and well-being inequalities related to disability requires efforts to promote equal access to healthcare services, as well as efforts to address underlying issues. Okay, let's look at age. Old adults may experience higher rates of illness and disability. We all know this compared to younger population. Okay, so the younger generation do experience. So older adults may experience higher rates of illness and disability compared to younger population. Factors contributing to these disabilities may include biological factors, changes in lifestyle habits, access to healthcare. Addressing health and well-being inequalities related to age require efforts to promote health to healthy aging as well as efforts to address these underlying issues. Then let's look at vulnerable groups in society. Vulnerable groups in society, such as homeless individuals, sex workers, and vulnerable migrants, higher risk of illness and disease, poorer health outcomes, and limited access to healthcare service compared to general population. Factors contributing to these disparities may include lack of access to healthcare, exposure to environmental toxins and hazards, and socio-economic marginalization. Addressing health and well-being inequalities related to vulnerable groups in society require efforts to promote equal access to healthcare services. Okay, then we have what we call inclusion health. Inclusion health is a term used to describe the health and well-being of socially excluded populations such as homeless individuals, sex workers, and vulnerable migrants. Addressing health and well-being inequalities related to inclusion health requires a multifaceted approach that considers that the unique needs and circumstances of this population. This may include policies and interventions that promote equal access to healthcare services, as well as efforts to address underlying issues related to poverty, discrimination, and social marginalization. Okay, very important. Health inequalities experienced by vulnerable groups, including vulnerable migrants, gypsy, Roma, and traveler communities, true sleepers, rough sleepers, and homeless and sex workers. Okay, then we can talk about vulnerable migrants. Okay, and that may risk of exploitation, abuse, or exclusion to their migration status or other factors. These individuals may experience higher rates of illness and disease, poorer health outcomes, and limited access to healthcare service compared to the general population. Factors contributing to these disparities may include lack of access to economic marginalization. Okay, this is very important. Then we know about the gypsy, those who travel, gypsy, the Roma traveler communication are often marginalized, and many experience higher rates of illness and disease, poorer health outcomes, and name them. Addressing the health and well-being inequalities related to gypsy, Roma, and traveler communities requires efforts to promote equal access to healthcare service, as well as efforts to address underlying issues related to discrimination, cultural barriers, and social marginalization. Okay, so we can talk about rough sleeping and homeless. Rough sleeping and homeless. Rough sleeping and homeless. We can talk about that. Rough sleeping and homeless. Where rough sleeping is people who don't have a place to sleep and therefore are lodging in certain places and having a rough sleep. Okay, they may experience higher rates of illness and disease. Okay, these are what we call rough people who are homeless. Okay, Sex workers. Sex workers may experience higher rates of illness and disease, poorer health outcomes, and limited access to healthcare services compared to the general population. Factors contributing to these disparities may include stigma and discrimination, lack of access to healthcare service, and experience to environmental toxins and hazards. Addressing health and well-being inequalities related to sex workers require a multifaceted approach that considers the unique needs and circumstances of this population. This may involve policies and interventions that promote access to healthcare services as well as efforts to address underlying issues related to discrimination, stigma, and social marginalization. Then overall, addressing health and well-being inequalities requires a comprehensive and integrated approach that considers the unique needs and circumstances of individual vulnerable groups. By addressing the root cause of health and well-being inequalities, it's possible to promote better health outcomes for all individuals, regardless of their social background or circumstances. Okay. Disease influence on health determinants. Health determinants are the various factors that influence an individual health status. These determinants can be classified into several categories, including social, economic, environmental, and behavior factors. Let's discuss some of the most social factors. Social factors can greatly affect health determinants. Economic factors such as income and employment can also have significant impact on health determinants. Low-income individuals may face financial barriers to accessing healthcare services or nutritious food, and unemployment that can lead to financial stress and negative health outcomes. Environmental factors such as air quality, access to clean water, exposure to pollutants can have an impact on health determinants. Living in a polluted environment or without access to clean water can increase the risk of respiratory diseases, skin conditions, and other health problems. Behavioral factors. Lifestyle choices such as smoking, drinking alcohol, physical activity, or also the impact health determinants. Engaging in unhealthy behaviors can increase the risk of chronic disease such as heart disease, diabetes, and cancer. Okay. Then genetics. Genetics, by understanding, can influence health determinants. Certain genetic factors that can increase an individual's susceptibility to certain disease or condition. Of course, if you have come from a family where you have stomach issues and stomach bulking, you naturally have that, but those can have impact as well on your life. Okay. So let's look at the wider term of health, social community, and then let's look at how to explain inequalities of opportunity that can impact the health and well-being of an individual. So firstly, we have to look into the limited access to education that can impact an individual's ability to make informed decisions about their health and well-being. Very important. Very, very, very important. Education can provide individuals with knowledge and skills needed to understand and manage their health, as well as access to resources. Okay. Then let's look at secondly, inequalities of opportunity in employment. Okay. Can an impact anywhere income can impact an individual's income and financial stability, which can then impact their ability to access healthcare services and resources. Individuals with lower income may be more likely to experience poverty, house stability, and food security. Very important. Then we have what we call the thirdly, inequalities of opportunities in healthcare that can lead to disparities in health outcomes. Individuals with limited access to healthcare services, such as those living in underserved or remote areas. Okay, that's the thirdly. And fourth, the social inequalities and marginalization. This can lead to increased stress, anxiety, and social isolation, which therefore can impact individuals' mental health and well-being. Discrimination and marginalization plays a major role in all this. Okay, very important. And overall, inequalities opportunity can have a significant impact on the health and well-being of an individual. Addressing these qualities requires a comprehensive integrated approach, which are there. By addressing the root causes of inequalities of opportunity, it is possible to promote better health outcomes for all individuals, regardless of their social background or circumstances. And below you have the references, which is the Harvard reference. So please ensure you read your model. You have to read chapter 6, the wider determinants of health, very important. Chapter 6 and chapter 5, inequalities in health, very important. Any other question, please do not hesitate to get back to us. Okay. So we expect to have your assignments started and presented in 2 weeks' time. Okay. We would try to have the assignment discussion tomorrow because we could not have it this Sunday. Okay. So we can have everything completed. All right. Thank you.